Thanks for staying with us. It's Tuesday. We just have to talk about health. So today we'll be discussing one of the illnesses that comes with excruciating pain and severe discomfort and sometimes lead to death. We are talking about toothaches. Toothaches can be incredibly painful and are some often caused by dental problems such as cavities, gum diseases, tooth infections, and so much more. Joining us on the show to discuss the management and prevention of some of these things is Dr. Oluwadolapo Adekanmbi. She's a consultant oral medicine, Department of Preventive Dentistry, Lagos University Teaching Hospital, Idiaraba, Lagos. Welcome to the show. You love fine doctors. Pretty looking doctors. Good
Thank
to have
you
on
for
the show.
having me. Thank you.
Toothaches. Let's start with what causes it, because people, I have been through my own season of serious toothaches. But tell us, how does it start? What exactly causes toothaches?
Okay, so when it comes to toothache, we have a lot of things that can cause toothache. But primarily, most people present with cavities. So when you have cavities, that's in simple terms, holes in the teeth.
Yeah.
So that's the main cause of toothache. So we have other things that can do with the infection or inflammation of the gum in the mouth. So these are things that are responsible for toothache, and these cavities, once they start, they keep going deeper and deeper and deeper till they enter to the root of the tooth, and they spread from there to the surrounding bone, and from the bone they enter spaces and could spread to anywhere in the head. Sometimes we have infection spreading to the brain. So a lot of people don't know this, and that's why people are so lackadaisical when it comes to toothache.
You know, I'm not, because I'm their customer. I'm the customer of toothache.
Are you serious? Interesting. Wow.
Why can you have good hygiene?
I ate too many sweets as a kid.
You don't eat gums.
So talk about, because as parents, we always try to see how we can stop our kids from eating sweets, but at the same time, this is the age they can eat sweets. So should we not stop our kids and allow the kids to have sweet things?
It's not good to allow the kids to have sweets, and that's because apart from the sugar content that you can expose them to, they get addicted to sugar, and sugar could be very addictive, and there are a lot of other things in the system that sugar can cause. But let's talk about the tooth.
Okay.
So it's going to create problems for the child, and they start losing their teeth early, even in their adolescence and then early adulthood. So it's not something that parents should do to compensate children. I think it's better to give children like fruit snacks, things like that can be given. You can give them nuts if they're not so young. You can give them apples. These are things you can introduce to children, and they get used to healthy living.
Yeah, but realistically, as you know, even if you don't give it to them, they go for parties, they go to school. You know, there are what do you call them, tuck shops that sell these things to them. So I think for us it would also be, what can you do when your children take sweets to help them?
What you just said to me just made me know that children get used to what you teach them, and that's the truth. Is what you show, what you do, that they get used to, and that's the way they grow, and that's what they do. So
so at parties, don't take party packs.
I'm not talking about not taking party packs. I just think that if you introduce a child to sugar early, the child would love sugar, and the child will naturally tend to take sugar. But if a child is not introduced to sugar, even when they take it, it's going to be like a one-off thing. Thank you.
I agree with you.
It's going to be one-off. I know that early in life, my daughter initially did not like sugar, and I was surprised. I said, is it that this child is just different? Because I think it's usual for children to love sugar, but I realized that she had not started taking sugar. I didn't introduce sugar to her. So once you introduce that to children, it's like you change their diet and their tongue, and they long for it.
Yeah, and their taste bud. So I love sugar. But when we're growing up, my mom, even though she wasn't schooled, she wasn't educated in any way, rationed it as a reward. So we only get to take cooler drinks every once a month. She buys a big 1 liter cooler and they'll pour small, so you drink, don't go outside and drink it. So we will go to party and get our party packs. We come home with it, submit all the sweets, and she decides when each of us gets what. And I did that for at least my first 10 years before I got freedom. I was able to buy my own sweets. And my first gum at 16, I've been trained since then. because I felt, they denied me. So I think it's what you train your child with, that, some of these things, some children, but some come like yours and they don't have the sweet spot. YK, for instance, can't take honey. My son can't stand honey, and he couldn't stand sugar until we were able to give him some.
Let's come to the health of tooth of timing.
So for tooth, I wanted to ask, because you mentioned, how it starts from a cavity and all the way into even affect the brain. Is it possible for a person to live their entire life and not know that they have a hole that can lead to all of this? Is there a way it presents in some form of pain or discomfort before you know, or you can have it and you just live with it?
Okay, so what that is that when there's let me just quickly explain what causes cavities. So we naturally have bacteria in the mouth, and this bacteria are like normal commensals in the mouth. They live in the mouth. So when you introduce sugar to them, they feed on the sugar, and the products they produce when they feed on that sugar is acid, and this is the acid that dissolves the tooth. So when this happens, you have the teeth, or the tooth in particular, dissolving. So what happens is that saliva in the mouth will try to protect that tooth. So it produces some other substances to buffer the acid that is being produced. And so when that happens, after some time, with the frequency of sugar intake, the body can compensate for the process again. So the tooth starts breaking down. So you have holes developing. And now, depending on the level of holes, the size of the hole that develops in the mouth. So initially, because you have what happens is the infection is in the tooth. It's a closed chamber, so there's so much pressure built up. So that's what causes pain. The pain is severe. So at that time, that can send alarm to the individual, and they want to seek help because it could be very painful. But there are some other times that you have a tooth badly broken down, and so when it's broken down, there's no pressure, so the person is just living their life. Just I have holes, but I don't have pain. So such people might not immediately seek care, and then which is even far more dangerous. It's worse because they don't seek care. Then sometimes you see badly broken down tooth. Some even have pus coming into the mouth, but they're not seeking care because they don't feel pain. So sometimes the pain can actually be.
So I was going to ask, because when my daughter took her kids to the dentist said there is one particular sweet that a child should never eat, and that's lollipops, because they put the lollipops in their mouth and they leave it in their mouth. What would you say to that?
Okay, so I think I tried to mention something around that when I was talking, like frequency. The more you expose that, I told you that the saliva can protect, like buffer the acid, but the longer you keep exposing that to sugar, so if you keep sweet in your mouth for longer periods, that is more dangerous. If you take sticky food like chocolates and then you leave them on the surface of your teeth for so long and you don't clean that out, that is dangerous.
So that comes back to the initial question I asked about children. We know that children take sweets. There is a movement for giving them less sweets. We get that. But now they do. What can you do, knowing that your child takes sweets, whether regularly at home or outside, to prevent tooth decay and these cavities, and just make sure that they have healthy teeth?
Okay, thank you. I think I understand your question better. Initially I was preaching avoid sugar, but really there's some kids actually that have been exposed to sugar. So, but there could be practices like reducing the level or the time of exposure, and once they're exposed, you teach them to rinse their mouth. Immediately after taking sugar, make sure you rinse your mouth out, and that is also because it helps the pH, which is that acid, to quickly pick up again, to go back.
Just rinse after chocolate. Just rinse out
your mouth and make sure
that's what I did with my daughter. So she didn't really have cavities, because every time she ate sweets, go and clean your teeth. Or I would clean when she was younger. I would clean her teeth for her, so she knows. Now she's an adult. Anytime she eats sweets, she'll go and clean her teeth.
I have this question for you. We were raised to brush our teeth,
Twice daily.
Rinse your mouth and spit it out.
Yeah.
Today they're telling us leave some fluoride in your mouth. You don't rinse it out. I'm thinking this guy just wake up from different sides of the bed and tell us different things. One second. So what exactly is it? Should we wash out our rinse out our mouth?
Okay, so I think someone asked me this question some days back, and the whole idea is that we just want to keep fluoride longer in the mouth. We want to keep fluoride longer. So the more you expose yourself to fluoridated toothpaste, the better. So sometimes they advocate you can leave it in the mouth, do not rinse out. And sometimes people are not comfortable with that.
Of course.
So they rinse out. But
Absolutely.
make sure you clean your mouth more than once a day. After your breakfast, after your dinner. So it's just how often you expose yourself to fluoride.
Okay, let me tell you, there's something also that's coming up. I'm seeing a lot of it now where people are being anti-fluoride. And they're saying fluoride can also cause the fluorosis, yes, and some actually affect your teeth, and instead you should go the natural route when it comes to cleaning your teeth. You know, so which is it?
Which one is the natural route?
Which is spices
like
cloves,
about toothpaste.
Even coconut oil is good too. I use
oil
coconut
pudding.
Let the doctor tell us the truth.
So please, fluoride is very important. Fluoride is very important for caries prevention, which is the cavities we are talking about. Then but when it comes to fluorosis, that has to do with the quantity, because the government tries to help, especially in areas they put fluoride in water, and this is regulated. So what happens with fluorosis is there are times probably a child is exposed to excess fluoride at a particular time, because we have different age groups and different levels of fluoride that they should be exposed to. A child at below 6 months, between 6 and 12 months, there's a level of fluoride that you expose children to. So fluorosis comes when you have excess fluoride in water, like community water that they're taking, and then that would affect their teeth. So you see some discoloration on the surfaces of those teeth. So but they're regulated. So, but when it comes to fluoride in toothpaste, that's very important because it protects your teeth.
So there's this new toothpaste that I've been seeing, charcoal toothpaste.
Yes, the idea of charcoal is they want to whiten the teeth. Yes, they want to bleach the teeth to look whiter. So people advocate use of charcoals and all that.
Does it work?
Well, yes, I've seen it work. It's an abrasive, so it works for external. If you have external or extrinsic stains. Stains are different. You could have stains in your teeth. They're called intrinsic stains. And you could have stains on the surfaces of your teeth. So if you have abrasives like charcoal, it can actually remove such stains. But that's surface stains. Sometimes we have naturally discolored teeth
so
inside.
this toothpaste that I'm buying that has charcoal inside is not good. I should go back to the
external stains. If you have like coffee stains,
I don't have any stain like that.
Is mouthwash really dangerous? Because we've seen advocacy about mouthwash and how it affects and even brings about health conditions like high blood pressure and all of that in people.
So for the mouthwashes or mouth rinses, we have different types. Some have alcohol, some do not have alcohols. Number one, alcohol-based ones are not safe because they dry out the mouth and you need saliva. I just talked about saliva. There are a lot of things saliva does. If I go there now, saliva is very important in the mouth. So there are a lot of things saliva does to protect the mouth. So you don't want to dry out the saliva. That's one part. Then the other part is that most of these mouth rinses too are antibacterial. So when we prescribe mouth rinses, when we do some certain treatments, we could use as adjunct mouth rinses. So when we give this patient mouth rinses, we usually give them for some period of time. Rather.
Not over time, not every day.
We don't give beyond 2 weeks. Thank you very much. Why bacteria, like I said some are normal commensals. That's because some organisms are in the mouth. Like in the mouth now, you have candida. But candida will not show itself because there are bacteria that keep the candida in check. So everything is in check. So the nature just has a way of putting everything check. So if you go there and destroy the bacteria in the mouth, you give Candida freeway. Oh yes, I have freeway. There's nothing competing with me. So we don't do that.
So we shouldn't have mouthwash in our shelves and everybody wake up every first thing you do it. You want to meet someone, you use it abusively.
Toothpaste, brushing the teeth is enough. Yes.
Okay.
Chewing
So
stick, because my father swore by chewing stick.
I love chewing stick.
Yes, we don't tell people to stop their chewing sticks. Even research has shown that there are a lot of chemicals in chewing sticks that are very beneficial, and we've seen people use chewing sticks for over as in all their lives, and then really so we are not. But what we always just tell people, especially when we go for these community outreaches and giving health talks, we always advocate that after you chewing stick, just try to use fluoride toothpaste.
Okay, we have to wrap up.
yeah. Oh, really?
That is all we can do. Well, thank you so much, Doctor, for being here. Speaking to Dr. Oluwadolapo Adekanmbi, consultant, oral medicine, Department of Preventive Dentistry in Glasgow. Thank you so much for coming.
Thank you.
Thank
you for having me.
That is all we can take on today's show. Hope you learned a few things as we have. Have a great day. We'll see you tomorrow. Bye for now.
Thank you.